بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is another talk regarding ChatGPT, how it is uh, needed for radiology training and learning. And in this short video, I will talk about mind map abdomen CT scan, how to read the CT scan regarding the ChatGPT guidance. Uh, Here we have the CT scan of the abdomen, and we have the preparation, and we have also the initial evaluation and detailed evaluation. In the preparation, you have to be fasting from 6 to 8 hours before the examination. Take water, about 1.5 liter, and we use contrast media to see the tissues and organs. And we should know have the medical history of the patient and any allergy to the contrast media. Uh, Initial assessment, we have to see the quality of the image, and we see the clarity of the images and not see the noise, and we should know the patient position, and we should cover the phases of the examination, and also we should uh, compare with the previous study. And we look at the CT scan and we look for the suspicious area, any enlargement of the organs, any masses or tumors, and and anything is abnormal, and also we should see abnormal changes, and we should look for collection of fluid. And in details assessment, we look for the organs like liver, and in the liver we look for the size, we look for the tissue of the liver and any masses or anything abnormal in the liver, and we should look for the vascular structures of the liver and look for any aneurysm or any uh, thrombosis, etc. This is for the liver, and this is the second organ. We look for the kidney, and we look for the size, and we look for the any changes, abnormality in the kidney, or we look for stones, and we look for the masses and cyst, and we look for also for any abnormal collection around the kidney or in the kidney. We look for the pancreas, as we said, in the other organs. We look for the size, we look for the pancreatic tissue, and any abnormality or masses in the pancreas like cyst or tumors, and we look for the pancreatic ducts, it is dilated or not dilated. Then in the we look for the vasculature of the abdomen, we look for the aorta, and we look for the main veins. In the aorta, we look for aneurysm, we look for stenosis, we look for thrombosis, and we look for the hemorrhage. And in the veins, we look also for dilatation, thrombosis, occlusion, and varices. In the tissues, we look for the fatty tissue, and we see the fatty tissue of the abdomen. Any changes in the fatty tissue, we look for the fibrous tissue, and we look for the calcification. And we look for the soft tissue, we look for the masses, cyst, we look for the changes uh, in the structure of the soft tissue, and we look for any masses or cysts in the soft tissue, and we look for signs of inflammation or others. In the bony structure of the abdomen, we look for the spine, we look for fractures, we look for any abnormalities, and we look for any inflammation, calcification, or tumor masses. In the pelvis, we look for also for fractures and any abnormalities in the pelvis and inflammation, and we look for signs of the hemorrhage in the pelvic region. And in the extremities, including in the abdomen, we look for the fractures. This is in summary what ChatGPT advise us and guide us how to read the abdomen CT scan. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك استغفرك واتوب إليك.